of working families and support an agenda that includes raising the minimum wage to an actual livable wage, a universal healthcare system for all, a state budget that prioritizes racial and social justice, and a sustainable economy for people and the environment. The folks leading out this presentation tonight are members of the RAD New Hampshire Healthcare Justice Core Leadership Team. Amy Hathaway, Jonah Wheeler, Melissa Bernardin, Laura Mitchell, Lynn Merlone, Reagan Lampier, Shannon Flynn. Sorry guys, give me a quick second. I'm sorry, Shannon Flynn, Beverly Piatlicki, and soon Sam Hammond. Tanya Prather, who helped with the conception of this idea, of this teach-in, and special thanks to MK Silcone for forthcoming tonight to share part of their healthcare story with us. Now, I'd like to invite everyone here to introduce themselves in the chat. So if you could put your name, pronoun, your town, and your pronouns, that would be amazing. We can get to know everybody. So I want to just kind of give you an overview of what we're doing tonight. So here's the agenda. We have the welcome and norms. What is Medicare for All? It's kind of a brief history of the healthcare in the United States. We're going to have time for breakouts and group discussion, and talk about our strategy to win and how you can take action with us. So what we'd like to start out with is kind of what our group norms are. So when we're in this space, how do we facilitate a good environment, right? So we'd like you to have your video on if you're able and have your audio connected, but also stay on mute unless we're in discussion or breakouts. We want to hold a non-judgmental space for others. Active engagement in the chat is encouraged. And also step up and step back. And what that means is we want everyone to have an opportunity to speak and to feel heard. So when you want to speak, step up. When it's someone else's turn, step back. So what have we seen under our current system with COVID-19? An additional 5 to 10 million people lost their health insurance in a pandemic, on top of the 28.9 million previously uninsured. 43.4% of people either don't have or can't afford to use their insurance. And we refer to people who can't afford to use their insurance as the underinsured. People are afraid to seek care when they need it most at a time when the health of our neighbors is most linked with our own. There's actually a new study about a cancer diagnosis at age 65, which actually illustrates the fact that people are waiting until they have Medicare to be diagnosed. More than 575,000 people have died from COVID-19 so far in the United States. 40% of those deaths could have been prevented if the United States had responded like other wealthy nations. For example, an earlier lockdown, mask mandate, and planning for the hospital capacity increase, PPE, oxygen machines. What it really comes down to is public health versus profit. You have that. COVID-19 has increased the life expectancy gap between Black and white people in the United States by more than 50%. Average monthly premiums in the individual market increased significantly, both in New Hampshire and across the United States in 2018. The average United States premium increased 25%, while average premiums in New Hampshire increased 45%. Meanwhile, healthcare providers have seen record profits during this time of COVID-19. We need a better system. We need a universal system. We need Medicare for all. So what is Medicare for all? It's a universal health insurance program to provide everyone in America with comprehensive healthcare coverage free at the point of service. A healthcare system like this is often referred to as a single payer system. Medicare for all is guaranteeing healthcare as a right to all people. So what does single payer mean? A single payer system means that there is only one payer in the system. This means that the government acts as the only payer, and we pay nothing at the point of service. You can think about public K through 12 education as an example, right? Individuals pay taxes to the federal government, who then act as the single payer that covers the cost of K through 12 education for all Americans. Individuals do not pay K through 12 pay for K through 12 education at the point of service. Instead, it's paid through tax dollars. Same idea. Under a single payer system, aka Medicare for all residents of the United States would be covered for all medically necessary services, including doctor, hospital, preventative, long-term care, mental health, reproductive care, dental, vision, prescription drug, and medical supply costs. To share their story, I would like to introduce MK Silcoin. And I'm sorry if I mangled your name, MK.
No worries. I'm Irish and quite used to it. So hi, y'all. My name is MK Kilcoyne. I use they, them pronouns. And this is my healthcare story. The first time that I saw what health insurance looked like was when my mother picked up my ADD medication. And on the bag, I saw the price that we paid and the price it would have cost without health insurance. That price was 10 times the amount that we paid. Now, I was 12 at the time, so I didn't really think anything of it. But later that year, my aunt passed away from cancer. And I remember my parents talking about how my uncle was never going to get out of that debt. Fast forward 10 years later, and now I've been diagnosed with cancer. I'm 22, so I'm still able to be on my parents' health insurance. But one day I got a bad scan. I ended up having to get a lobectomy. So what that was taking a small piece of my lung to be able to biopsy it. And I was in the hospital for maybe a day or two. By the time we got home, we already had a letter from the insurance company telling us that it was not medically necessary and they were not going to pay for it. Now it's 2019, a few days before Christmas, and I am so incredibly sick at work that I have to leave, and I drove directly to a convenient MD right down the road. Unbeknownst to me, my work had already canceled my health insurance, and by the time I was able to get a temporary number, it was 4 days later, and that number wouldn't provide me with the prescriptions that I needed. A couple months later, I went in to get COVID antibody testing where I tested positive. So during that time, I actually had COVID before it was named. With Medicare for all, this country could thrive instead of just barely surviving. With access to mental health counseling, those who are suffering, especially at this time after pandemic, could get the help they need. Trans folks could get the gender-affirming care without having to take on GoFundMe. People could call an ambulance instead of an Uber when they're in an emergency. With Medicare for all, we give people the dignity they deserve to get better and stay healthy. Thank you so much. I'll pass it back.
Thank you, MK, for sharing your personal story tonight. Next up, we have Jonah Wheeler, who's going to facilitate this next section.
Thank you, Heather. Well, I'll be talking about how we got to our broken system. The United States has made a number of attempts at universal health care, beginning with the reformers in the late 19th century, as a part of their effort to improve labor conditions. There was no true leadership in government on this issue, and despite Teddy Roosevelt believing that no country could be strong when their people are sick and poor, most of the work happened in the underground, with organizations such as the American Association of Labor writing what is largely considered the first healthcare bill in 1915. This was a years-long fight coordinated opposition from the private insurance industry, the AFL, and others. World War I 1917 allowed these opposition forces to write off this effort as a German socialist insurance, which would be a mantra that would be repeated for centuries in the fight for healthcare. It's largely understood that progressives in this era failed because of a sense of naivete in the face of such great power, alongside tactical errors inside the legislation that went after the giant structure of commercial life in America. Which takes us to FDR and his 3 attempts at universal healthcare. Roosevelt had so much political capital because of the Depression that you'd think it'd be the most opportune moment for healthcare to finally be guaranteed in this country. However, including healthcare as a part of the New Deal proved to be a steeper hill to climb than previously thought. The first attempt through the Social Security Bill of 35 was overshadowed by the Second World War and an economy that demanded more immediate assistance than the healthcare program. And the other 2 attempts were met by a conservative resurgence in the election of 38 and the swamp that is the federal legislative process. After FDR died, Truman moved the issue into the national consciousness, with the issue finally receiving unbridled support from an American president despite the political climate of the Cold War. The war again gave the opposition a newfound strength, and the effort became entangled in the socialized medicine label and was used as a part of the Red Scare in the beginning of the McCarthy era, which allowed the government to prosecute the underground organizers working for social change, which put back the movement a lot of years. After Truman, there was no real elected leadership pushing the issue of national health insurance, and what was left of the movement yet again went underground. Until the passing of Medicare and Medicaid in 1965, after leaders like Martin Luther King pushed President Johnson using the power of the civil rights movement and pushing the issue back into the national consciousness, getting President Johnson to sign Medicare and Medicaid. Those programs would end up being the true foundation for what would become Medicare for all and what we're fighting for today. Which takes us to 2010 and the ACA, with another conservative resurgence after Medicare and Medicaid and in the political climate after that. The Reagan era truly stamped out any potential progress for a national health system for now 4 decades. The Obama administration was able to pass the individual mandate under the Affordable Care Act in 2009, which was an extremely important step, bringing the issue back into the political sphere. And after years of inaction, a step was finally made and could be the catalyst for us finally making the right approach to healthcare. Now I'll hand it off to Laura to talk more about the ACA and its benefits.
So the ACA has lowered rates of uninsured people and allowed millions of folks to purchase insurance through the exchange at more affordable rates than we'd ever seen before. Another positive change from the ACA is that it lowered the numbers of uninsured people in BIPOC communities. Though the uninsured rates dropped from the inception of the ACA through 2017, from
The trees haven't even fully.
From 2017 to 2018,
you guys were gone.
they slowly started ticking up again. Then the pandemic hit, and as many as 10 million people lost their employer-sponsored coverage. Additionally, under the ACA, we've seen higher deductibles, higher copays, and higher out-of-pocket expenses, while at the same time, policies offer less coverage. GoFundMe has become something of a default insurance provider, with fully 1/3 of campaigns seeking funds for medical expenses. People are reduced to begging friends, family, and even strangers for the money they need to get medical procedures and medicines to get well or even just survive. The ACA keeps private insurance, which puts profits over people. We have all had experiences where a doctor has recommended or prescribed something and the insurance company has denied it. I myself was on a medical leave from work a couple of years ago, and the insurance company initially denied my claim. Eventually, fortunately, I was able to get that covered, but it took several appeals, and the appeals process itself set back my healing quite a bit, and the leave ended up being longer than it would have needed to be otherwise. Another unintended consequence of the ACA is the 80-20 rule, which requires that insurance companies spend at least 80% of the premiums they collect on medical claims. This was intended to lower premiums, but instead it increases claims. Insurance companies are happy to pay higher prices because 20% of more expensive care equals more profit for them, and they just pass the costs on as higher premiums and higher deductibles. Additionally, the ACA being federally mandated but managed by the states has been extremely problematic. Many states did not expand Medicaid, so there's different policies and different care available from state to state. The ACA is important but insufficient. In 2019, the national uninsured rate was about 10%. In New Hampshire, nearly 7% of all adults do not have health insurance, and the numbers are of course higher for BIPOC and low-income individuals. Of course, uninsured is only part of the problem. High deductibles and other out-of-pocket costs lead to enormous numbers of people being underinsured. As much as 28% of people with employer-sponsored coverage and about 44% of people who purchase through the individual marketplace are underinsured, meaning they have insurance and still can't afford the care that they need. While Medicare for All would not solve all of the problems around racial inequity in healthcare, it would considerably level the playing field for those communities. The ACA is inefficient because insurance becomes a middleman. A great deal of doctors' and patients' time is spent doing paperwork and fighting with insurance companies rather than focusing on care. And of course, the insurance companies have to get their cut, leaving less money for care. 50 different insurance systems in 50 different states leads to confusion and unequal care. In-network facilities with out-of-network providers lead to surprise bills. The ACA is unjust because individuals' access to care is determined by who their employer is and what state they live in. Costs vary widely across locations and even between facilities in the same city. BIPOC and low-income individuals are far more likely to be uninsured, underinsured, or live in areas where high-quality, affordable care is just not available. The ACA is unsustainable because an insurance model is more of a sick care model than a healthcare model. Very little time or energy is put on wellness and preventative care. Individuals put off routine procedures and screenings until the required care is more expensive, and in some cases, until it's just plain too late. Now I'm gonna send it back to Jonah.
Thank you, Laura. So after hearing that, it's pretty clear that now is the time for Medicare for All. And I'll be talking about the benefits of Medicare for All in the next slide. Thank you. So the benefits of Medicare for All is it is a low cost and equitable healthcare system that gives all Americans the right not to die because they cannot afford healthcare. Has no networks, no premiums, no deductibles, no copays, no surprise bills. Medicare coverage will be expanded and improved to include dental, hearing, vision, and home, and community-based long-term care, inpatient and outpatient services, mental health and substance abuse disorder treatment, reproductive and maternity care, prescription drugs, and more. No or little cost at the point of service for all of those things. And Medicare for All is a racial justice issue. As Laura said, BIPOC communities have long been most hurt by our for-profit system and would most benefit from Medicare for All. Now, the question we get asked most often as organizers or people who support Medicare for All is, how will we pay for it? The same way we pay for schools, roads, and the fire departments. We'll pay for it together. Americans already pay an exorbitantly high cost for healthcare through private for-profit insurance companies. Instead of giving money to the for-profit companies, the government will act as the sole provider of health insurance, which will dramatically reduce the cost because the government can negotiate with providers, drug companies, and will be the only game in town. New taxes will be created on the wealthiest individuals to help Americans have access to quality health. And this is the same way the wealthy pay more in taxes so that everyone has access to schools, roads, and fire departments, as I said. The bottom line is we are already spending the money. It's just the wrong people paying. Repeated studies show that Medicare for All would save the US trillions of dollars. One study conducted for COVID-19 estimated that Medicare for All would save almost 70,000 lives every year. We paid these costs before the pandemic, and we will continue to pay these costs every year that passes without single payer healthcare. More specifically on Medicare for All, it would save the US $450 billion a year, according to a Lancet study, possibly because of the cost-saving measures inherent to Medicare for All, like global budgeting, negotiating prescription drug prices, people accessing less costly preventative care versus care for late-stage illnesses, and busting up healthcare monopolies. These savings are on top of 68,000 human lives. It is 68,000 human lives it is already projected to save every year. Currently, the burden of paying for the care we all need falls on the average person. Through copays, premiums, deductibles, and under Medicare for all care would be free at the point of service. There are a number of proposals for financing that would move the burden to corporations and the wealthy, financing so that the burden would move to the corporations and the wealthy, so that the average person and family would save significant money on their annual healthcare costs. Now for some frequently asked questions, I'll hand it back over to Laura. Thank you.
Under Medicare for All, could I still see my same doctor, go to the same hospital, etc.?
Yes, no insurance networks means no more limitations on where and by whom you can be treated and cared.
How would Medicare for All impact doctors? Would they still have the independence to make treatment decisions?
Under Medicare for All, doctors can focus on what they do best, which is caring for and treating patients instead of coding, billing, insurance approvals, and appeals.
I have heard that in some countries that have single payer systems, there are long wait times, and isn't care rationed in countries with single payer?
Under our current system in the US, care is rationed based on income, race, gender, disability, and many other barriers set up by the industry. Currently, only over 70 million people in the US cannot afford healthcare they need. Long wait times, the result of more appointments needed and not enough appointment slots. Patients in the US currently have long wait times under the private insurance system. Eliminating the time doctors spend dealing with the insurance companies will free doctors up to provide more care. Medicare for All guarantees payments to hospitals so that they can stay open, especially in areas where there are less healthcare providers. Keeping capacity up increases appointment slots. According to a 2014 Commonwealth Forum study, most countries with single-payer health insurance do not have wait time problems for the category of care.
But how would Medicare for All impact seniors who are already on Medicare?
Medicare for All will provide current Medicare beneficiaries with better care at a lower cost. Medicare for All expands Medicare coverage to include dental, hearing, vision, and long-term care. It will also eliminate all Medicare premiums, copays, and deductibles. Seniors will be among the biggest beneficiaries for Medicare for All.
Right. I think I'm going to turn it over to friend Isaac Grimm for this next part. And I am going to just stop sharing this screen here, and we're going to put these questions into the chat for y'all. So as we go to breakout groups, that you'll still be able to see the questions.
All right. So that was a lot of slides and a lot of information, a lot of really compelling information and arguments and answers to questions. Can everybody hear me? Just making sure here. Thumbs up if you can hear me. Awesome. Okay, great. So thank you again to folks who helped put the presentation together, stepped up to volunteer your time and provide the information and provide your own perspectives, your own stories. MK, thank you for sharing your story. It takes courage. We love you. We appreciate you. So with what we just hopefully had sink in, we wanted to allow for some space to be able to process that together and discuss together. So what we're going to do is we're going to set folks up in breakouts. I'm going to drop a link into the chat here where you can have one person in each of your breakouts help take some notes, because what we want to do is not only have this event be, an opportunity to provide some really important information to arm us with the facts and the arguments that we need to be able to carry this work forward and build the political mandate that we need in New Hampshire to be able to win universal health care, push our federal elected in the right direction, change the public perceptions in the right direction. We want to get your input as well. We want to understand what questions you have. And we want to make sure that there's some space for relationship development to happen here and for y'all to be able to get to know each other, debrief this. So the two questions that we want to make sure that everybody discusses together, give yourselves a little time to introduce yourself, right? But number one, like, how do the stories that we heard resonate with you, with any personal experience you've had dealing with the healthcare system? And how would you see your life changing once medical coverage is not just a constant concern and burden and overly complex thing, right? So that's the first discussion question. And then two, are there any concerns that you have that were not addressed in what we just went over with the reviewing what is Medicare for all? What are the arguments for it? What are some of the common questions? So what are the things you want more clarity on, right? So those two questions will drop in the chat here so you can see them. They're also at the top of this notes doc, which everybody can hop in so you can refer to that and just pick the group number that you are in to take notes there. And we're going to have about 15 minutes for breakout discussion. I'm excited to see what folks come up with together, where you're at, what the questions are that come up, because this can really help inform our work and make it stronger moving forward. So with that, are you good to go on moving us into breakouts, Heather? All right.
I am
So
open
you're going to see it pop up on your
rooms.
screen. Cool. So you can go ahead and jump in yours, and we'll give everybody a little heads up before we break back into the full group.
Oh, I'm going to be alone probably, aren't I? Well, I'll jump in. I'll jump in somewhere. All right, and Isaac, you're going to lead this next report back part.
Yeah, are we all back from the breakout? Okay. So we've got, and everyone came back. No one dropped out. That's amazing. There's always somebody who's like, breakouts, and they leave. So thank you all for sticking around through that and coming back so we can debrief that a little bit. I appreciate y'all. So I hope folks had good conversations, that you got to, maybe see someone you know and care about and got to meet new people. I can't wait till we can, like have an in-person meeting and do breakouts that are literally just having people go to tables and then we all come back together. Can't wait. So I'd love to hear from folks, just kind of report back if anyone is willing to step up and just share anything that stuck out from your discussion, of how the presentation around Medicare for All resonated with y'all, kind of any visioning around what life could be like with a universal healthcare system, or questions that came up. Is there anyone who would be willing to step up and give a little report back? And you can take the screen share off there. We can just do the gallery view. Is that Heather who's running the slides? Can you just take the slides down? Cool. All right, awesome. Anyone willing to step up and just share a little bit from your group discussion? David, you come off mute. Hopefully that's because you wanted to speak.
No, I was trying to play with it to change my name, to take this SEA staff off my name, but I don't know if you guys are on a new version of Zoom or what, but it won't let me change it. Jonah actually took the notes from my group in group 2, so.
Oh yeah, I can share for our group. I mean, I was actually gonna share and bring up a point that David said about how if we had Medicare for all, it would release. He talked about how he had known some wealthy people who didn't have to worry about where their next dollar was coming from, and how so many people who have healthcare, that's their number one worry. And if people didn't have to worry about their basic needs being met, that's so much stress would be relieved. And I added to that point in the end, saying I think that so many countries view the United States as this one big rat race, this stress-filled land of people addicted to fast food and et cetera. And I think having universal health care would be such a huge step towards relieving that core stress that's at the fundamentals of our country, and yeah, just relieving that underlying stress that everyone feels from having to worry about their basic needs being met on a day-to-day basis.
Thank you, Jonah. Appreciate that. Anyone else from your breakout? Anything you'd want to share? Something you learned, or something that, a connection that was like, oh, I had a similar experience to what someone else shared? Don't be shy, y'all. This is a safe space. Margaret.
Oh,
Let's go Margaret first, and then Jody.
you go. Oh, okay. One of the things that we talked about was how this is going to be paid for, which is something we've heard some about, but not a whole lot, because currently Medicare pays about 10% over cost, and it's probably not that rate is probably not sustainable. And actually, interestingly, in the group that I was in, there were 2 physicians and 1 spouse of a physician. Obviously, if they're, people are wondering where their paychecks are going to come. Healthcare providers are wondering where their paychecks are going to come from too. And if most hospitals, I mean, it's not just the providers, it's not just the doctors, but most hospitals couldn't survive on what Medicare pays right now. So there would have to be, because commercial insurance, for all the problems that it has, picks up a big part of the bill, and there's a lot of cost shifting to commercial insurance. So a bigger part of the conversation, I feel like there needs to be, is where's the money going to come from? Because nurses have to be paid, hospitals have to be kept open, and at the price that Medicare pays right now, it's really not. It's not feasible. As much as we would like it to be, as much as I would love it to be, it's not. And the other thing I was going to share with my group, I told them I would find a couple of sources from a class that I did recently that has to do with healthcare reform. And it had to do with international healthcare systems and people's satisfactions in other countries who have single payers, and how just exactly how well it. If I can dig those up before the end of the program, I'll try to share those.
That would be terrific. Thank you, Margaret. And just real quick before I pass it to Jody, anyone who happened to be in a breakout with any of the physicians who are on here, or the folks who have Physicians for a National Health Program, which has incredible chapter here in New Hampshire. Kenneth, is there anything that came up for you that you'd want to share when that discussion around what it would mean for doctors and nurses, and how Medicare for All could really function as a national program? Is there anything you'd want to just add to that?
Sure. In terms of reimbursement to physicians, I am not worried about going to a Medicare template or metric for reimbursement. All the private insurers basically base their payment schedules around what Medicare pays. But if you look at physician satisfaction in the US, physician satisfaction, despite the fact that many docs in many fields, radiology, certain surgical subspecialties, make big bucks, many docs are very unhappy practicing in the US because their overhead and the time consumed by negotiating and being on the telephone with all of these various insurance companies is truly insane. Doctors typically like dealing with Medicare because we don't have to get approvals, jump through hoops to get a test taken care of or a procedure done. If you compare the amount of dollars spent by a physician's office, This has been done. You could look at, I could send you references if you like. It's just shy of $100,000 a year. That's $100,000 a year to pay for a full-time person to do the drug approvals, authorizations, overrides, to do the testing for every CAT scan, every chest X-ray, etc. It is extraordinarily burdensome for physicians. That's part of the issue about burnout. So reimbursement in terms of dollars, actually, I don't agree that the dollars are not there to adequately reimburse American physicians. Just one other comment, and if I'm talking too long, just put me on mute and take the cane out. But the other thing is, something else to be aware of, a lot of young doctors are coming out of medical school with $200,000 worth of debt. And some of those same docs would love to go into primary care. There's not enough primary care docs in the US. I know where I live, there's a shortage of primary care docs. There's no shortage of dermatologists. I shouldn't say that. There may be a little bit depending on where you are. But docs have to go into subspecialties that reimburse very well, very quickly, to make up for a huge amount of debt. Every other country figured this out long ago. You reimburse docs based on their need for the community. Make sure everybody, if you have a pilot, you want to make sure they're well paid. You have a surgeon operating on your heart, you want to make sure that they're well paid, not going hungry. But we have no balance in this country. If you ever wondered why you see so many commercials on television for orthopedics, get your knee replaced at Dartmouth or go to, there's a very good reason you're seeing advertisements for particular subspecialties. They're not advertising, we have the best primary care docs in Southern New Hampshire, because docs don't make much as primary care docs, but the hospital makes the big bucks by these particular subspecialties. So there's a lot of economics involved that you're seeing day to day that you may not recognize, that inflates the cost of medical care and that docs are suffering with in a unique way. So anyhow, plenty to talk about, but.
No, thank you. That's super valuable perspective, and just makes it, even more evident how we have this very perverse incentive system, not only for us as folks who need healthcare, but for healthcare professionals. Appreciate that. And Jody messaged and said she didn't necessarily. So, how much time do we got for reflection here? Should we move forward, or do we have space for one or two more?
I think we have space for one more. I don't know about.
Can I respond?
Yes,
Can
David,
I actually
great.
just interject? I just want to refute the fact that if Medicare pays 10% above cost, the cost for the hospitals and for the nurses is part of the cost. So it is above and beyond that. To say that, I mean, that's basic business 101. Those costs should already be included in it. So, on top of what Dr. Dolkart said, that is just not really true.
What do you
totally feasible?
Can I ask you what the 10% is in reference to?
Me? The person that went before had said that that Medicare pays 10% above cost, but the cost already includes the cost for staff, for the doctors, the nurses, and other staff. So that's already included. And of course, we'd be able to take out so much of the overhead that's all around the insurance industry.
Sure, agreed.
Well, I was just quoting some statistics that I had read. And I don't think there's any dispute that there is cost shifting from what Medicaid and Medicare cover onto commercial insurance. So I don't think you could just take the same budget that you have now. And the other big issue, and sorry, I'm probably taking up too much time. Medicare pays really,
actually, because we pay 3 times more than other nations that have universal health care. We're actually paying 3 times that, between 2 and 3 times that. So that is totally bogus.
Well, part of the what's interesting is, Margaret, I would love to, if you can find any of the statistics that you're referring to, and you mentioned earlier about the public opinion polling, would love if you can share that, if you can find that in the chat, because that is statistics I've seen as well, about like, you know, people's satisfaction with their healthcare. I think that's really important. Something too that's, you know, what we're talking about here is not a system that's, you know, comprised of just the elderly and then is competing with this over-bloated, overly influential pharmaceutical and health insurance industry, right? We're talking about really a vastly different system, one that's not based on the profit model. And so what can be possible within that when you are taking out these perverse incentives is very different. So I want to just make sure, because there's, you know, a lot of folks here who were able to break out. I'm sure a lot of stories were shared. If there's anyone else who did want to just share anything that stuck out from you from your breakout, or a new kind of, you know, piece that you learned or that you're holding right now from your conversation or from the presentation before that, if there's maybe one more person who hasn't gotten to speak up yet who would like to share.
I don't know if Joey or BJ from my group would be comfortable being put on the spot, but we had an interesting conversation about rural hospitals. Would either of you want to share on that?
I mean, as just like rural hospitals currently with the for-profit model are just stuck in limbo, where if the population gets too low around them, or even just if their costs go up slightly, they can very easily get shut down, because if they're in a system or out of a system, it's because they can't function on their own. Whereas in a single payer model, the costs being shifted around and held by everyone in common would allow them to most likely be able to stay open for much longer, or for in perpetuity, as long as they have people in that area, which would, I don't think enough, or that it seems like that would be a very good way to show off the plan to people that are currently against the model, thinking that it would hurt them in some way. Whereas like if they believing that they taxes go up, but if you don't have a hospital there, what is that little bit more, or the little bit of money that you save on taxes going to really help you with? Because you have much higher, if you have a kid, you can't get to a hospital that quickly. Melissa had talked about that, and just other little issues that could be prevented, or people that could get healthcare if they had medicine closer to them.
Thank you, Joey. Yeah, we found that although Joey and BJ were actually calling in from other states to join us here in New Hampshire for this conversation, that the rural hospital concern is a common thread, because we're even seeing some of our rural hospitals in New Hampshire are having financial sustainability challenges. And that's also another thing that's become more and more clear under COVID.
Can I make a comment about that? Because you guys are
Kenneth, that would be great. And then after that, and Melissa, if you could take us into the next piece, that would be great. Yeah, Kenneth, go ahead.
No, you're entirely right. And just in Springfield, Vermont, there's been a hospital that's just closed recently. What you're getting at is the American health system. Hospitals basically make their income from the insurers. So if you are working in a city and you're attracting all these people to have their orthopedic procedures, you're getting the big bucks primarily from, you stay afloat from the private insurers who pay a little bit more than Medicare and a lot more than Medicaid. If you're a rural hospital in any state, particularly in a Rust Belt state, most of the folks you're serving are on Medicaid or Medicare. These are folks who aren't bringing in the big ticket items, and you're often hemorrhaging money for a lot of the folks who don't have insurance. What the Jayapal plan and Bernie plan, both plans have for decades had as part of the mechanism for reimbursement is what every other modern nation on earth does, which is global budgeting. So a hospital will basically be provided the amount of money it needs to take care of the population of the people it serves. It's not based on who you can overcompete for because you just had to buy a new MRI machine so you could charge for the MRI where somebody down the block has the same test. It's basically global budgeting, and there's much to be said for that in terms of how, rural hospitals stay alive, and that issue would disappear with that. Anyhow, I thank you for bringing that up. I think that's an important issue.
Thank you, Kenneth. So appreciate folks providing some of your thoughts, questions, feedback. Kenneth, really appreciate you providing your perspective. And we're gonna now move back into a bit of further presentation around our strategy to win, our strategy to move forward. So Melissa Bernard's gonna take us there, and you gotta hit present, not share. I always do that. There you go. All right. So Melissa,
Great.
take it away.
All right, thanks. Yeah, so we have 2 more sections to our meeting with you here tonight. So thanks for sticking with us. I know that I really enjoyed the breakouts to have that dialogue. So now we're going to talk about our strategy to win. We've talked about why we need Medicare for all and how our lives would be changed for the better under it. The strategy to achieve this reform begins with thinking about who the decision makers are. So to enact this reform that we need to change federal law. So the decision makers are our Congress people. And so we need to move them to do the right thing. In the next slide, we want to share with you that we're starting in a strong position when it comes to public opinion. So nationally, the public supports this. There are many other polls in addition to this one out there, but we thought that this poll from a right-wing source of all places was telling. So Fox did some polling of voters in the 2020 election, which showed overwhelming support for Medicare for all. In fact, 72% of voters nationally support changing to a government-run healthcare plan. And this is not surprising, knowing the failures that so many Americans have experienced with our current system. In the next slide, we want to share with you a snapshot of where we are with Congress. So as most of us know, Democrats control the US House by a slim majority for the next 2 years. Currently, 118 out of 235 Democrats in the US House have co-sponsored Medicare for all. And while we are making progress nationally, none of the 4 members of New Hampshire's delegation have co-sponsored to date. So Chris Pappas in our 1st district and Annie Custer in our 2nd district need to hear from us. We expect the bill to be introduced in the US Senate later this session, and now is a good time for Senators Hassan and Shaheen to hear from us. So while this is the reality of what we're up against, while we are on the path to Medicare for all, there are some other proposals that we can also rally around. We can support the Medicare expansion bill, Bernie's bill, which, if we were able to get that in place in our country, will illustrate for everyone how, or at least the folks who would be newly included, how a Medicare for all system could work. So first, by improving it and then expanding the age groups eligible by making the eligibility 55 years old and older, or maybe even bringing it down to 50 years old. So in the next slide, we're going to pause for a minute and ask, so if public opinion is on our side, and so many millions of Americans know that our system is so broken, if Medicare for all would save money, stress, and lives, why doesn't every member of Congress support this? Or even why aren't all Democrats signed on, at least? So the answer lies in the hundreds of millions of dollars spent nationally by the pharma industry, the insurance industry, and the for-profit hospital and nursing home industry on lobbying our Congress people. They have the ear of Custer, Pappas, Shaheen, and Hassan. They also give our Congress people campaign contributions. So what that means is our voices need to be so loud that we drown out the voices of these lobbyists and the campaign contributions of these lobbyists. In my last 2 slides, I want to talk about what we're going to do about corporations buying our elected officials. Right now, we are, number 1, demanding our elected officials stop taking money from health industry corporations who lobby against Medicare for all. Our premiums should go to providing us with health care, not opposing reform that the public wants. 2, we're going to call out the healthcare industry when they lobby against reform. And get involved with us, stay tuned, we'll give you more specifics on how exactly we're going to do that. And I know as we just stay back on that one slide for a second, sometimes it does seem like an uphill battle. There's so much money in politics. Those of us who are involved, we see it, we know it. Sometimes it feels really overwhelming, but I'm a part of this, and I know that everyone on the healthcare justice team and all of you who are here tonight know that when we believe in something and we fight for it and we let our Congress people know that this is an issue that is important to us when we vote, we believe that we can win. So in this last slide, I just want to show you that we are making these demands in the context of a larger multi-pronged effort, which includes education, changing the narrative, coalition building, so bringing in other organizations and partnering with them, changing public opinion, and exercising voter power. So RAD is part of a national network through People's Action, with progressive grassroots groups building support across the country. And as a statewide group, RAD works with our membership and builds support among allied organizations all over New Hampshire. We're happy to have some of those groups with us here tonight. So tying this all together, there are two main aspects to our overall strategy. Directly putting pressure on our federal delegation to get them to support this reform, and doing the outreach and education to build a groundswell of support and moving the majority of the public to go from supporting this reform to demanding this reform. There are many tactics, from calls and meetings with our legislators to speaking out in the media, to local resolutions, to getting healthcare professionals, businesses, people who have been directly affected by the failures of our current system to join our fight. We all have our own networks, so I like thinking about starting with our own networks, bringing people we know and groups we're a part of into the work with us, and we can build strength in numbers that it will take to win. So before I turn it over to Heather to close us out, if you have any questions or ideas you want to contribute to this strategy, feel free to drop them in the chat. And if working on this larger strategy and reaching out to your personal networks or professional networks to help grow support for Medicare for All in New Hampshire is something that appeals to you, let us know in the chat and we can follow up.
Thanks so much, Melissa. That was great. I really appreciate the strategy piece in all of this. I am going to try to do this all at the same time. Here we go. As you can tell by what we've been talking about tonight, we're in a literal fight for our lives. So I just want us to take a moment to think about all the people that we've lost this year. I believe the number is over 575,000 people we have lost this year to COVID. Those aren't the only people that have passed. There are many people who have not been able to get the care that they needed. We heard about all those GoFundMes that people put out there. Some of those people make the money that they need to get the treatments they need to live and to have a life. And they've been failed. They've been failed by our system, our profitable system. So I just wanted us to just take a breath, take a moment, and think about all those folks. But also, like, we can win. We can win. We have to think positively. It's going to be a battle. We're going to have to fight for it, right? So yeah, just a moment. I just want to take a moment because one of our members of our healthcare team couldn't be here tonight because a family member got COVID again for a second time. So we are, our hearts are out with Amy tonight. Thanks, y'all. So, anybody ready to take action? I know I always am. You can count on me for that. So let me find my place. We have some pretty big goals this year, right? We want to bring new people into this work with us. We already have over 2,000 petition signatures, and that still hasn't been enough to get our delegation on board with supporting this bill. Our goal is, I want to get over 5,000, because next time that we have a meeting with our delegation members or their staff I want us to be able to say, look, there really, really is strong, not just a little bit of support. This isn't just a fringe thing. This is mainstream, and it has become more and more mainstream just in the last 4 or 5 years. So I know we can do it, but it's going to take everybody that's here tonight, sharing this stuff out with folks, talking to your friends and neighbors, because I can talk a lot, but I can't talk to everybody in the state. I've tried. So anyway, it's going to take some work, and even talking to the people that aren't necessarily political or may not be sort of totally on our side yet, right? We need to have meaningful conversations with those folks too, not just the folks that are already in our circles. It's the only thing proven to change anybody's mind, right? Like having a one-to-one conversation or a small group conversation where both sides are listening and both sides are respecting each other, right? That's how it's going to happen. We're going to have some serious one-to-one conversations. We're also inviting you to take part in a house party program this summer. We are going to package all of this up. We have a video of this that we'll share with you, the agenda, or if you want to do the slides yourself, you can do that and have a little house party yourself. If you want to invite, a small number of people over that have already been vaccinated, you can do that, or you could do your own virtual thing. You could have some members of our healthcare team come and join you, or not. You can do it on your own, but we would be happy to help you with that. So those are a couple of things that we have going on, but somebody's gonna post the link to sign our Medicare for All petition in the chat right now. So you can do it right now, and on that petition, there are some things you can sign up to do. You can sign up to be part of the healthcare team, right? You can sign up to be, you can sign up to, I think, to have a house party. You can sign up to phone bank with us, or text bank with us, or we're gonna have a Canvas program this summer. So these are all possibilities. You can sign up to help us. Do you write? We need people to write LTEs and op-eds, things like that. We need you. There's a place for you here. So sign the petition. I hope somebody's putting that petition in the chat. I see the orange light on, so I'm going to just keep going. You can also, if you can't do any of those things, you can also, if you're able, support us by becoming a sustaining member of Rights and Democracy. That even if it's a small amount, it doesn't matter. All of those little amounts add up to something. So if we're all putting in a small amount, it can be a really big thing. So the first call to action is sign that Medicare for petition. All right, that's in the chat. The second call to action that we're going to talk about, and I'm going to put this on the screen because I'm just talking too much. We're going to share this next link with you. It's for the Patients Over Profits Pledge. It's a click to email action. So when you put your information into the boxes there with your zip code, it will come up with your whoever your delegation is. It'll have Chris or Annie Custer on there, and then Maggie Hassan and Jean Shaheen are 2 senators, and it will automatically populate an email for you to send to them. It's really, really easy to do. You can even edit the email and add some of your own language if you want, or why it's important to you. So we're going to take a couple of minutes and let people do that, and I'm going to play a song, and then we're going to come back in just like 2 minutes maybe. We're going to rock out to something. I don't know. Did that get shared in the chat?
Yep, all the links are in there.
All right.
The link to sign Medicare for All, the link to email our federal delegation, to push them to sign the Patients Over Profits Pledge, and the link to become a member of Rights and Democracy if you're not already.
Cool. I think we only have one more link, and we'll talk about that in just a second. Do people need a minute to do that, or is everybody just done? Let's give them.
I would say, also, it only takes a moment to sign the Medicare for All petition. Do make sure you check off the boxes so we know how you want to get involved. And then the click to email, that might take you, a minute or two, especially if you personalize it. But if you get through that and you're like, what else can I do? Please share out the Medicare for All petition and the Patients Over Profits advocacy form there with anyone that you know. like share it out in your Facebook network. If you know folks that, you know, are responsive to email, sharing those links out with other people is going to mean, you know, it's not just you taking this action, but you can get a lot of other people to move with you.
Cool. Thanks, Isaac. Yeah, I think those are the last two, the first two things. The last one that I sort of added on as a third thing it's not actually in our slideshow because I thought of it just the other day, and we want to invite you to continue the conversation. And RAD has a community Slack workspace now, and I don't know if you're familiar with Slack, but it is it's a way that a lot of groups now, well, it's an app. I'll start there. It's an app that people use to communicate when when people aren't in contact with each other all the time. It's a way for people to communicate, share articles, have conversations, and check in when it's convenient for them, when emails and texts kind of seem like too much because people's inboxes get so full these days, and it's a little more personable because a lot of folks in the rights and democracy community know each other, and more we want to promote that. We want people to get to know each other all around the state, because that will also build our power. That will build us stronger power. So when we also sit down with our delegation, they're going to take us seriously because they know that we have a huge collective here in the state that is working on these issues. So thank you, Isaac, for sharing that. So that's the last thing. That's the last thing I have tonight. Anybody else have anything before we go?
Can I have everyone who's on video, like, either, you can do whatever you want. You can put your hands up or you can just smile, but I would love to get a screenshot of all of us. If you're not on video, come back on video so we can get everybody in here. So let me, are we ready? A couple folks aren't on video yet. There you go, Margaret. Lynn, Tanya, Josh, any of y'all able to? Not required, but you know. I'm not doing it yet. Just wait. Hold it. Maybe Tanya is gonna come through. She gets 3, 2, 1. All right, we're gonna screenshot it. All right. Everybody say Medicare for all.
Medicare for all.
All right.
Hey, actually, can we just do this? Everybody just come off mute, and can y'all just like show some love and applause and appreciation for all the members here who just organized and pulled this off?
Sure.
Yeah. Thank you.
Who's mooing?
I'm doing the Arsenio Hall. Okay, guys. I mean, no, nobody.
Oh, one other thing.
Brain.
We don't have the event up for it yet, but if you've never heard of him, Adi Barkan is an amazing national leader. He has ALS. He has to communicate through a device now, and he actually has to like communicate through blinking, and it helps type out the words and speak for him. Really, really inspiring, incredible national leader. He's going to be doing an event with us, I believe May 18th. We don't have the event up in public yet, but like save the date and we'll share that out with everybody. We're really excited to be working with Adi. He's just incredibly inspiring. And, you know, like all of the presidential candidates, you know, during the primary tried to meet with Adi. He's just, you know, he's helped push the conversation around Medicare for all and around healthcare reform for a long time in the face of debilitating disease. He's amazing. So we're really excited to have an event with him coming up very soon. We'll let y'all know about that, and we'd love to see y'all come back to that and to bring 5 friends with you, right? So we can have 5 times as many people in that event with Adi. How's that sound? Can y'all bring some folks?
Woo woo!
Beautiful.
Yeah, I just want to raise up a victory. I don't know how many people here worked on this campaign and sent a postcard to President Biden to free the vaccine, so that the pharmaceutical companies aren't owning the vaccines all around the world, so that we can actually end the pandemic. And Biden came out, the White House came out yesterday in support of the TRIPS waiver, which will allow this to happen. So thanks for everyone who participated in that, because it's really nice to win something for a change. So, woo.
Yay.
Yeah. All right. Well, thanks so much for coming tonight. We appreciate you all. And yeah,
Why is my hand not showing up?
what's that?
Yeah.
I'm trying to
Get your
wave.
vaccination shot if you haven't already. As Kenneth said, get your shot.
Get your shots. I'm immune today. I'm immune to death.
Woo! Got it yesterday. Second
Woo.
shot.
Woo, woo.
All right.
Happening.
If the team wants to stay on and debrief a little bit, we can do that. I thought I might play a song if people are and play us out. But please keep in touch. And I'll put my email in the chat here too. If anybody wants to reach out, I would love to hear from you. Woo.
Next, the boy is.
Oh, that's not going to do it. I'm going to figure it out. I'm persistent.